Bob and Brad, the two most famous physical therapists on the internet.
Hi, folks. I'm Bob Shupp, physical therapist.
Brad Heineck, physical
Together,
therapist.
we're one of the most famous physical therapists on the internet.
In our opinion, of course,
Tell
Bob.
me a story, Brad.
Bob, there's this woman. She's a lovely woman. Her name is Kathy. She's in her 60s. I don't know her exact age.
So she's young.
Yeah, she is young. And listen to this. She's had some hip arthritis on both sides, went to the doctor, got some exercises online, and she started doing these exercises, and her hip pain started to improve.
Feel better.
Yep, because she
Not
started moving
surprising.
them, stretching them out. We preach this all the time.
Right.
But now she wants to go to the next step. She wants to get back to skiing.
Gotcha.
And she's wondering if maybe we could show her some exercises to bring her to the next level.
I think we can do that.
Absolutely,
By
Bob.
the way, if you're new to our channel, please take a second to subscribe to us. Also, you're going to want to join our giveaway. We're doing a giveaway a mattress.
Right.
And this is a sample of one. We like to show this because it shows the individual mattresses and the air channels.
That's right.
And this is going to be a lot more comfortable than any regular mattress.
Right.
So go to the giveaway section, sign up for it. It's a Sleepovation mattress. They send it right to your house. You can pick the size you want. You're going to love it.
Yeah, that is a high-end mattress. It's right up there with the best of them. When Bob and I, we like ours. We actually love them. But anyway, let's get on to hips, Bob. We're talking hips. So, Bob, I'm going to go through a few stretching exercises that Kathy may have not have done. She showed me, showed me them, and this is a little option for her or anyone else. So I like this, and this is some of the ones I personally do. You could just take a belt. You don't have to have a stretch strap like this, although they work really well and they're not very expensive. But you can just take a belt and loop it and go around your foot.
Brad's got a whole routine here.
Yeah, and I'm actually abbreviating this a little bit for these people. The first one, while you're lying down, you can do this in your bed or on a carpeted floor. I just use a mat on a hard floor. Bring the knee to the chest like this.
Straight hip flexion.
Yep. Just bring it up. And I'm pulling here. The nice thing about these straps is I don't have to grab it like a belt. You actually put your hand in there. You can relax your fingers and pull. You can go around like this. And then I'm going to go over this way. So the knee goes across the chest, and that gets some different muscle groups, that piriformis in particular. Right. It's a problem muscle, Bob.
Exactly.
Creates pain, and if we stretch it gently, it works good. All right.
I think the gemelli also give you trouble.
Oh, the old gemelli. You can't forget that. Now this next one I like to do, and you're going to work the hamstrings up like this. And then just let it roll out while you're holding the strap, and it gets the hamstrings and the groin muscles.
If the hamstrings are tight, they are going to affect your hip.
Absolutely. Yeah. This is one of my favorite ones. It really does a nice job on that hip area. Now this next one, I bring this knee up, put this here, the ankle there, and then I'm going to push gently here, depending on how tight you are. And you may find that you may have to start down here and then bring your knee up as it loosens up.
Actually, you could probably do this one in a chair too.
Yep.
You can sit down and every once in a while, go ahead and cross your leg over and push down on the knee.
Just like when you put your socks or shoes on. Right. Exact same position. Now, this one is a little unusual. Some people may have to start easy, but you pull this way and then let the knee drop in like this. So you're stretching that hip out. There.
Internal rotation.
Now, this last one, this is important for someone like Kathy. She had a desk job for 43 and a half years.
She's retired?
Yeah, she's retired.
Okay.
And off the edge of your bed is where you have to be. And then you just let that, it's going to stretch that hip flexor, which tightens up for people who sit a lot.
Exactly. You may not even get close to this. Your knee might be,
way up here.
Yes.
Yep. And if you grab the other knee and pull up, watch this knee. It's going to oftentimes come up like that.
Right.
So you relax it. You can put a little pressure on it. You'll feel that stretch right.
Let gravity do its thing.
Yes.
So work over time.
30 seconds, 15 to 30 seconds on all of these. Do it on both legs. All right. Bob, now, this is going to be the key thing for someone who wants to be active And this kind of activity, I don't know if she's cross-country skiing or downhilling, but it's going to be important to do for either activity, so it doesn't really matter.
And I'm not going to go into the details of why you want to do this one,
Yep.
but line up your legs. So match the knee with knee, ankle with ankle, and you're going to just simply do clamshells. So can you see the clam?
Yeah, Bob, you look like a clam, all right.
Now you're going to start without any resistance
Right.
or any weight along this, and it'll be enough. I mean, you'll find out these are pretty small muscles and they get pretty sore over
Right.
time. So you can do these. I do probably 3 sets of 10,
Yep.
maybe 3 times a week.
Yep. That's how I would start. Monday, Wednesday, Friday is a good way to start.
Now, eventually, if you want, you can add some resistance. And we got the Bob and Brad. Well, we call them booty bands. I don't know what else to call them.
The small loop straps. You can use other ones, whatever you have around or you want. But these are really nice. That's why
they're very
promote
comfortable.
them.
Yeah,
and the price is good.
Yeah, they come around the hip and they don't roll up on you.
Yep.
They're really nice. So this is a lot more work. I mean, you're going to work hard on this.
But for skiing, you definitely need these muscles strong, or for other activities where you're walking, hiking, those types of things. Now, if you don't want to do that, you feel like you want to be a little more advanced, you can. And I'm going to suggest starting either with, you're going to have to, buy some equipment for this. There's just no way around it. And do it standing. You got the tube strap with the handles, and we're simply going to do this. Hip abduction with resistance. If you need some, put both in one hand on the wall. If you like, you're going to do 10 on that leg. Then you're going to do 10 on this leg. If you happen to have the loop straps, they work just as well. I like loop straps a lot, but it really doesn't matter. You're going to do the same thing, and it goes like this.
Brad, can you do the just walking along too?
That one's coming up next. Yes. Yeah, oh, yeah. I wouldn't forget that one.
Well, and I'm going to show one now, just the sideline hip abduction. So basically, again, you line up your knees, line up your ankles, keep your legs straight this time. So now I'm going to work on keeping the toe pointed forward. Don't go up like this.
Ah, yes.
And you're going to work on strengthening the hip.
Yep.
Under control.
Now, I'm going to show you the next step, a little more advanced. But again, for a weight-bearing activity, that hip muscle is going to be strengthened better this way. Again, the loop or the band or the tube or the loop, you're going to do like this. Get the resistance where you need to and walk sideways and working those hip muscles. Whoa, yes. Again, if you have a loop, it works darn good.
Same thing, works well.
I would do this with shoes on. I have stockings on right now, which is okay, but shoes would be better.
Yeah, they grip better on the
Yep,
feet.
and your balance will be better. It's more realistic. So I go like 10 feet over and back. You'll feel these hip muscles going to town, starting to burn, and that's when you want to stop and take a break.
Now we're also going to have you do some posture squats. We like you doing posture squats because it keeps your back in the right, right alignment while you're doing it. Kind of trains you to do it correctly.
And regardless of what activity you're doing, you want to have good posture with it.
Right. And you can take a broomstick or anything long PVC pipe. We have a booyah stick here, and basically I'm going to grab on like this, and so I got my upper palm forward, my lower palm is back
right here,
and I'm going to line it up so that I have 3 points of contact.
One here, and one here, and that assures you that your back's in good posture.
Right. Now, if I do it wrong, I go like this, I have 1 point of contact.
Separation here. We don't want separation.
Train you to correctly lift and put the pressure on the hips and not the back.
Right. So, Kathy, when you're skiing, you want to make sure you have that posture.
Right.
Is critical.
Yep.
And this helps your body learn that, particularly with your hips as they're coming off of this pain, and your body. The pain really can throw off your posture and your balance and kind of things like that.
Can.
So you can take your loop strap. The next step is put this around your knees, bring it out like that, and do the exact same thing that Bob done, except for that loop strap really
makes it harder.
Oh boy, I can feel that on my back. those glute muscles, the abductors,
Yeah.
and the upper fibers of the glute max. And that's another. This is
Keep your knees
great.
out.
This is great for that skiing. Boy, I'm kind of getting pumped up. I got to get out on the
Yeah,
slopes.
there we go.
Now there's one other one, and this one, you just hold
I
on
thought
both of
maybe one
those.
of both.
Yep. This is a really ideal one, particularly for a cross-country skier, and you'll see
Sure.
why. You need an anchor, or you put around a heavy piece of furniture, or something that's not going to give. You can do either.
He's either got a loop or he's got a cuff.
Yeah. So if you happen to have the bands, they almost always, like ours,
Yeah, they come with cuffs.
have an ankle strap. So I'm
Yeah.
going to put this here. Put this here. Now, if you just have this, you're going to have to go with another band and put it to the other leg, or you can just wrap it around your leg. If you happen to have the loop bands, I'm going to do one with a loop and one with a tube, just so you see how you work it.
Sure.
You don't have to have a strap around the leg. You simply go like this, and this is a. Then
Looks
you
like you're
simply
skiing.
good posture, and you can see if you're doing classical. Inline
Cross-country skiing.
Yep, inline cross-country skiing, you can see how this directly relates to the motion. If you're going downhill skiing, you're still working all those hip muscles, especially those flexors, which are probably tight. And you're going to do this, and I would do this for time, or you can count, 10 to 20 reps, or you can go for, as you get better, I would go for time, particularly before you get out there on the slopes and feel
What do
strong.
you mean for time, Brad?
Well, like 20 seconds
Oh, sure.
or 30 seconds, or build yourself up to a minute. Then you don't have to count.
Right.
Put a timer on your cell phone and let it beep. I'm getting tired, Bob.
I like
That's
that,
nice.
Brad.
Yeah.
That's a good simulator.
Yeah, that
know?
is, it just happens to work out really well for that activity. But again, if you're not skier and you still want to stay active on your feet with whatever activity, these are all going to
Yeah, they're all good
appropriate.
for you.
Yep.
And use the ones that you think help you.
Right. None of them should create any pain,
Right.
particularly sharp pain. Just that muscle fatigue
We're
is all
not
we're
big
looking
into
for.
pain.
Yeah.
So,
All right.
all
Well,
right.
be careful on the slopes, Kathy, and we hope you have a good time. I don't know where she's going. Vail, Europe. I'm not really sure.
I'm not sure either, Brad, because I don't know where.
I actually don't either.
Yeah,
It's a
yeah.
friend of a friend.
Oh, gotcha.